Heart disease is the #1 killer for both men and women in America. Over 460,000 due to unforeseen and sudden heart attack. My guest today will discuss signs and symptoms and seeking early intervention through medical treatment. Joining me is Jamie Wilkerson, who's Director of Critical Care and Cardiovascular Services with Heartland Memorial Health. Jeremy McLean, who's the Director of Emergency Department at Heartland Memorial Health, and John Malcolmson, who's the Director of Emergency Medical Services with Hardin County. So we appreciate you all being here today.
Thank you.
Let's start with a little bit of anatomy of the heart. We know it's a muscle, we know it's important. Tell us a little bit how it's related to cardiovascular disease.
Good deal. Well, coronary artery disease or coronary heart disease are both used interchangeably in healthcare. They're both a global problem as well as a local problem. Basically what it is the hardening of the arteries. Plaque builds up on the interior wall of the artery, which makes it difficult for blood flow. That narrowing of the artery causes blood clots easier to form, which at that point in time would be a heart attack. And I hope the viewers today, by the end of the segment, is able to establish some of the signs and symptoms and what to do basically when that does happen. Some of the facts on that, there's over 1 million Americans will have a heart attack this year, which is about 1 in every 42 seconds. So the importance of it being a local problem and a global problem and the community awareness is kind of the goal that we have today.
Well, Jamie, too, I think as we talk about this problem, really understanding that it's here in our community. Now, when we talk about age, generally we're seeing it happen in the older population because you talked about the plaque buildup,
Yes.
but it's actually happening sometimes to people in their 20s
Oh,
because
yes.
of our lifestyle habits,
We
correct?
see them younger and younger every day come through the hospital, and these gentlemen can attest to that as well. But the interesting fact is it's not just the elderly population that has the issues now. But the important thing to know is a lot of the risk factors that we're having are modifiable, which means the exercise, the weight management, the stress reduction are all controllable factors that we can—
And smoking.
that we can help decrease our risk of having that heart attack.
Now, Jeremy, let's talk about a heart attack is not just, we hear the word heart attack, we've also, a heart attack is not just a heart attack, I guess I want to say, as far as types. So tell us a little bit about a term called STEMI, and what does that stand for?
Sure. STEMI is a medical term used by healthcare professionals to describe what is the most lethal type of heart attack. STEMI actually stands for ST segment Elevation Myocardial Infarction. And simple terms, it's a heart attack. We can identify STEMI very easily by an EKG, and that's why it's so important to have early intervention, early medical treatment whenever you're having this type of heart attack. There are several types of heart attack, but like I said, this is the most fatal type.
And is that because, I think I read too, that STEMI, is that because it's the largest part of the muscle is affected?
Well, it's the most common area of the heart. When you look at STEMI, generally you're looking at an inferior type of heart attack, which means, you know, the bottom piece of the heart starts to die pretty quickly.
So, you know, when we hear the word heart attack, people can have different types because it can affect different parts of your heart, correct?
Absolutely.
So when we come to the emergency department, tell us a little bit about the signs and symptoms that you see a person exhibiting.
Sure. The classic signs and symptoms that you would normally see or normally experience would be chest pain, shortness of air, sometimes chest tightness, and usually that's associated with some excessive sweating. Diaphoresis is what we refer that to.
Okay, now John, we know that unfortunately not everybody experiences the symptoms the same. Tell us a little bit about the gender differences between males maybe experiencing a heart attack and a female.
Right. The big difference is a lot of times that females don't exhibit the exact same signs that the males typically do. Males will present with the crushing chest pain, sweaty, vomiting, where the females sometimes only complain of nausea or just simple pain to the shoulder or the neck or something like that. Women present a lot differently than men, so they need to be more aware of the signs and symptoms so they can recognize what's going on.
So if someone in the community is actually experiencing these signs and symptoms, what should they do? John.
Call an ambulance.
Okay.
That is actually the most important thing, and I think that's what we want to come out of this more than anything. is over 50% of the people that still come to Hardin Memorial Hospital with a heart attack come by private vehicle. I think that was what the numbers were in the last meeting we had.
Yes.
And I'm sure that if people realized how much care can be started prior to their arrival to the hospital, that they would call the ambulance versus driving in a car. Plus, it's more dangerous driving to the hospital, and it's been proven that calling an ambulance versus driving yourself improves survival rate in a heart attack patient.
Because of the medical intervention, correct?
Right. When the paramedics get there, they do the 12-lead EKG. They give the patient nitroglycerin, which is a medicine that dilates the arteries and helps the pain. They give the patient aspirin. You know, so a lot of things can be started. The IVs can be started all before we get to the hospital.
So let's talk again and stress the importance of understanding the signs and symptoms, because sometimes a person that's maybe experiencing the heart attack may be going through what they call kind of that denial. So review again the signs and symptoms. I think, Jeremy, you went through those.
Sure,
again with us.
yeah. Many times people mistaken just subtle symptoms could be they feel like they're having reflux or acid in their stomach causing a burning sensation in their chest. Many times that is passed over, and unfortunately, time is of essence when you're talking about a STEMI type of heart attack. And any subtle symptom that you may have that relates to coronary artery disease could be a true sign. So I think we have to really listen to our body, especially in this time of year as the community starts to get out and starts to move and starts to exercise and be active. We have to really listen to what our body's telling us, and early intervention, like John said, is key. The first medical professionals that we can have there on scene are the EMS folks.
And I think you stressed too, John, in saying, right there in the ambulance when the when the paramedics are arriving, you all are in contact with each other because we want that continuity of care for that patient. So you're really talking to each other. What can we do? What's the next step? And making sure that they have the best quality of care and then hopefully the best outcomes for this individual too. So we've talked about signs and symptoms. We've talked a little bit about prevention. How do we diagnose maybe once we get to the hospital, Jeremy? What happens next? I guess maybe in the emergency department, then we'll move to Jamie.
Okay.
Yeah.
We rely heavily on just early activation of our overall STEMI system, and really that starts with the patient at the home and EMS on arrival. If we can get that diagnostic EKG from the house, that really makes everything start to work in the hospital. We have contact with EMS immediately. They're able to start movement in our as far as getting our cath lab team ready and prepared. Our ER physicians and our staff are ready to accept the patient, and so it really starts with that first medical contact. That when that EMS truck shows up and they're able to do that diagnostic EKG, that's where it starts.
So I've heard the term EKG. So then they hit kind of the emergency department. Obviously, we want them to come in through the ambulance.
Right, because what a lot of people don't realize, and I want to point out too, is the EKG that we do, which is the heart tracing that they do on you when you go to the hospital when you're having chest pain, we can send it electronically to the ER.
So they're ready
from the
to
home,
go.
from your living room. So they have it before we even leave the house.
And we have systems set up there in the hospital to where we can get that EKG directly transmitted to the ED, so physicians can look at that and determine if it is a STEMI to get the appropriate personnel going in a faster manner.
And they're getting the medical treatment that they need right away, and everybody
And
tells
the ambulance is not just transportation to the hospital.
Not just a ride.
Absolutely.
They're getting medically treated through the whole process.
Right.
So we've talked about the going through the ambulance, getting to the emergency department, and then what's the next step maybe as far as procedures? What happens? We've heard the term cath lab.
And I want to stress time is muscle at this time. We have certain goals that we meet with cardiologists and local EMS departments on a regular basis that discusses our numbers. I want to stress time is muscle. So we have certain goals that we want to hit from initial contact. From the time that ambulance arrives on scene, we want to start it right then. We want to have ED notified. We want to be able to call the cath lab in. We want to notify the cardiologist that, hey, we have a sick patient that's coming through the doors that may need to go to the cath lab. Cath lab process, we have a fantastic staff there, and we're blessed to have that in our community to where doctors are readily available to be able to intervene on patients when they come through. Basically what that consists of is you go to cath lab, they're able to run dye, and they're able to look at your heart and see those narrowing arteries and to see that blood clot, which would be your heart attack, and intervene with that, whether it would be pull that clot, place a stent, and different interventions like that.
So we have a picture actually of that, and tell us where that actually gets threaded. Is that through the leg?
Yes, and that's a good question. If you've never been to a cath lab or see, it's kind of interesting that actually the majority of the time go through the groin. We're able to actually go through the wrist as well on certain patients who are candidates for that. But when they do go through, they inject a sheath in there, and then they put a wire in there where they're able to shoot dye and view that heart through images. In the cath lab, the physician is actually able to, on a big screen, see that heart and see exactly where the clot may be and to where that damaged muscle is to go in there and intervene to
know what the next step is.
Yeah, to increase that oxygen flow to save that muscle.
Very important. Now you talked about actually the time is muscle, and that you had the goals. Again, that's always to help the patient get the better quality and get the care that they need for the next step, correct?
Oh, yes.
So we've got to get them in and taken care of as quickly as we can too. So we're going to know the signs and symptoms. We're going to make sure that we call the ambulance. And I think we really have to stress not to hesitate, because a lot of people want to think that I'm going to be okay, everything's going to be all right. And so that's where we really want to make sure not only we have to know our own bodies. I think, Jeremy, you had said that too. But we have to watch out for other people and say, no, I really think we need to go, and you need to call right now, 911, or I need to call for you sometimes and make that call. So we're getting them in through the ambulance, making sure they get into the emergency department and get the care, and that communication's going on all the time. And then the cath lab, and what happens maybe after the cath lab?
After the cath lab, we have certain nurses that watch the patient for a certain period of time. That patient is usually put in an inpatient status to where we have certain floors designated to take care of those cath lab patients.
And so then they're maybe taken care of and maybe have to learn new quality of life as far as their lifestyle habits that they might have too.
And then I do want to stress that a lot of the risk factors that we have, especially in this area, are modifiable. If we could all stress the importance of getting that exercise in on a daily basis. It's so easy to go home after work and sit on that couch and watch the TV shows that's out there now, but to get that 30 minutes of exercise per day, to get a weight management program, and to really focus in on the smoking and the stress reduction and those modifiable risk factors that we're able to control as a community. And I think a lot of what our goal is here today is to get that awareness out there to the community, to know that the risk factors that I have for heart disease, which is 1 in 4 deaths in the United States, I can control that.
And also talk to your personal health care professional about your personal medications that you may be on, if you're, high blood pressure, cholesterol, those types of things. We know that relationship with heart disease. Also family history. But again, a lot of what we do day in and day out actually puts us at risk.
Yes.
We've been talking about communication and partnering with your healthcare provider, but also you all are a team. Tell us a little bit about how you all communicate and making sure that you have the best quality of care for our local community.
I'll start with that, guys. We actually have a Central Kentucky STEMI system of care, which involves not only Hardin County, but the 10 surrounding counties, to where we meet on a regular basis and we discuss all of the times that we're going through with each specific case. We're benchmarked against every other hospital in the United States, so we look at all those numbers, we meet with the cardiologist, and we discuss as a group on things that we're doing really well on, and then also some insufficiencies that we may need to work on. But it's really good to have that collaboration, not only with the cardiologists, but with all of the local EMS agencies. And they're all very eager to come to these meetings, to hear what we have to say as a group, and to get ideas on improvements and how we can continue to be innovative in treating patients in the community.
Sounds like you really have everyone involved, because again, we've been using that term, kind of that continuity of care, but the patient is getting taken care of from literally door to discharge, and following up with the cardiologist then afterwards too. And when I said door, I mean getting on that ambulance,
Right.
making sure that they're taken care of, they're in the emergency department, the care that they're having while they're in the hospital, but then also follow up
Yes.
with the cardiologist too. So you mentioned not just Hardin County, but all the surrounding counties too. 10 counties, is that right?
Yes, 10 total counties there, and that I think the number of people that we do serve is it's over 300,000 people in that general vicinity. So it's a ton of people that we can reach out to, and we've got tons of different EMS outreach plans coming up in the near future, to where we're actually going to go to the EMS departments and discuss ways that we can improve care, not only from the initial contact of the patient, but also coming through the emergency department and once they hit cath lab till their discharge. So what I think is so important about that is that transparency between the groups, to be able to be honest with each other and talk about ways that we can improve care.
Well, Jeremy, too, we've been talking about the emergency department, and we have a very busy emergency department. Share with our viewers the volumes really that you see
Yeah,
here.
Absolutely. Our emergency department has grown 10% in volume each year, and last year we had seen right around 58,000 patients, and in 2015 we are slated to see about 67,000 patients. So we are growing tremendously, but I refer back to, if you have those symptoms, if you have anything that is concerning to you, as far as what you're feeling, don't hesitate to call 911 and have those ambulance show up very quickly and be able to start that treatment.
John, we've been talking about the volume that they have.
Right.
On average, how many runs do you have?
We last year we did over 15,000 runs just in
Wow.
Hardin County. So that's a large run volume. And I think what I wanted to say too is what you said earlier, I think is very important, is it has to be teamwork in order to work. So, and that starts from the wife that notices her husband isn't acting right, or the teenage kid that says, "Mom, you've been on the couch all day, you're not acting like you feel good." It starts with that caller, and then 911 here in Hardin County, 911, they start giving instructions over the phone how to care for the patient prior to arrival. So, I mean, it has to be collaborative. We have to have, and we do have a good working relationship and communicate well in order for the process to work good for the patient. So just the patient's families need to remember they're the first step.
John, when you said 911, I thought to myself, my gosh, over the years, that I have been lucky to live in this community, how we've really expanded that service too.
Right.
Because, there for a while, not everyone had the access to be able to do the 911.
911 is a huge asset for any community. Of course, Bob Hammonds runs 911 for Hardin County, but they really are the first link. Right after the caller makes the call, they're giving instructions. They're making sure that we get there, that we have the right directions, the right address. A lot of times they alert the hospital if we have critical patients and let them know ahead of time that we're coming.
And John, I'm thinking as you're talking too, I think we need to stress too, when somebody is calling 911, don't ever hang up. You need to
Right.
stay on the phone.
Right, and I think Bob would appreciate this, but also know that when you call 911, you shouldn't hang up until they tell you to hang up.
Right.
And then also remember that just because they're asking you questions doesn't mean that the ambulance isn't on the way. A lot of people think, and some people call and say, well, they were asking questions for a long time. What they don't realize is there are 2 or 3 dispatchers. So while one person is asking you, when did the pain start and are you nauseated, there's another dispatcher sending the ambulance at the exact same time.
Everybody's, again, back to
Working
your
together.
teamwork, everybody's working together.
And that's how it has to be.
Right. What else can we stress to our audience regarding the importance of understanding and really that STEMI component of that type of a heart attack? We've got to get in and get taken care of right away.
I think the biggest thing that I wanted to portray or get across is that they need to call an ambulance. Don't drive yourself. It's extremely dangerous. Most deaths from a heart attack occur within 2 hours of the first onset of symptoms. So don't delay. When you have the symptoms, call. We can come to you, we can start the process, and hopefully if it is nothing, that's fine. But if you are having a heart attack, early detection is the key to survival. really.
Very important.
Right.
So early detection, whether it's yourself and or someone
Right.
else noticing those
Right.
signs and symptoms,
Right.
very important. Jeremy, anything else that you'd like to share?
I'd just like to, just stress that, again, this type of season, our community is getting out, and we're starting to be active, and you have to really listen to your body and really listen to what it's trying to tell you as far as symptoms. Those classic symptoms of chest pain and shortness of breath and excessive sweating, jaw pain, and those are the things that are the subtle hints that maybe something is actually happening inside of your heart. And the best thing that you could do is call 911 and let medical professionals give you the care that you need early.
Jeremy, I heard you say, jaw pain. What about shoulder pain? And did we talk about that and maybe radiating down the arm? Any of those?
Absolutely. Jaw pain is somewhat of a symptom that usually may happen with females and diabetics and that sort of thing. But you definitely have referred pain from any kind of muscle pain. So in this case, from the heart, you can have that referred pain down through the arm, up through the jaw. When that's associated with a nausea or dizziness, palpitations, you can almost bet that there's something going on that's not right in the heart.
You used the word palpitations. I could hardly get that out. Sorry about that. But tell us maybe what you hear when somebody's trying to describe a palpitation, so they might know what.
Yeah,
that
it may
means.
be that that feeling a sudden skipping of the heart. You can feel a little bit of flutter in your heart, and almost associated with some shortness of breath. Kind of takes your air away, and if that continues to occur, then you can almost be certain that there's something not right that's going on there, and need to be seeking medical help as quickly as possible.
Good point. Thank you. Thank you for sharing that with us. Jamie, what else do you have to share with us?
I just to shadow these guys, I think from a preventable standpoint is to follow up with those physicians, and I think you hit on that, Karen, how the importance of to make those doctor's appointments regularly and to follow up and to be consistent with the plan and the regimen that the physician's given you. Make those appointments. That will help make you healthy and to get it out to the community and to be that leader of your health, because that's all we have.
And I like that leader of your health. I think you really have to take responsibility for your own health actions and really partnering with your healthcare professional. They can tell you, and suggest what you might need to do and work with you, but you actually have to follow through with those every single day in order to take care of yourself. Well, we'd like to thank all of you for being here today and sharing this important information. And again, we really want to stress that you learn the signs and symptoms, recognize them amongst yourself. We hope that you don't have to again, and also with friends and family members. Make sure that you call 911 and seek that medical attention so that you can have hopefully some good outcomes and get taken care of right away. For more information, you can go to www.hmh.net or www.heart.org, and that's for the American Heart Association. Again, we hope you tune in next month for another important edition of Health in the Heartland.